Welcome to the All About the Medicine podcast with Dr. Nola Knows. Today we are going to talk about nutrition and diet. I have a custom weight loss program, and this topic is going to be where you start when you're thinking about starting any weight loss regimen. It's nutrition. So the type of nutritional diet that you're going to be on, you want it to be something that is going to be a long-term lifestyle change. There are a lot of fad diets out there, and we're going to discuss the top ones. I wish I had more time to discuss all of them, but I'm going to make this as easy as possible. We're going to talk about the 6 most common types of diets that they have out there. They have a balanced low-calorie diet, as well as a low-fat diet, low-carb diet, high-protein diet, very low-calorie diet, or intermittent fasting. I'm going to start off by talking about the keto diet. It became really popular in the 90s with the Atkins diet. And I hear a lot of patients ask my opinion on it. And mind you, disclaimer, this podcast is for medical education, not medical advice. So please always consult with your physician before you start any diet or exercise regimen. So back to the topic. So let's talk about the keto diet. So the keto diet involves eating foods that are high in fat and moderate protein intake with low carb intake. So it's not recommended, especially by cardiologists, because we've discovered that keto diets actually increase your risk of cardiovascular disease. In some instances, like if a person has resistant epilepsy and they've tried all of the medications, they may recommend a keto diet, but it is very, very restrictive. And sometimes they have to be admitted into the hospital for observation when starting this diet. So let's talk about a true keto diet. A keto diet is going to involve ingestion of a lot of high fatty containing foods, okay? And it could be very restrictive and time consuming on your lifestyle. So they include very little amount of carbs. So you'll need to avoid carbohydrates even in otherwise things that are not foods, like toothpaste, binders in your nutritional supplements, and things of that sort. And you'll also need to probably ingest some vitamins to make sure that you're not getting nutritionally deficient being on this very restrictive diet. I don't recommend this diet for diabetics because they have other complications that having been on a keto diet would actually make their risk of cardiovascular disease even worse. So if you're a diabetic, keto diet wouldn't be the diet that I recommend. No. Cardiovascular disease is the number one cause of death overall, like just overall. So we don't want to implement any lifestyle change or any diet that's going to increase that risk. The first diet that we're going to talk about is a balanced low-carb diet. So the two that are recommended by most physicians and medical consortiums is going to be the DASH diet and the Mediterranean diet. A low-calorie diet recommends that you consume about 1,000 to 1,500 calories per day. The Mediterranean diet is going to involve a high consumption of fruits, vegetables, wine, preferably red wine. The DASH diet is going to be composed of 5 servings of fruit, vegetables, and 2 other servings of low-fat dairy products a day, like cheese and things of that sort. And less than 25% of your calories that you ingest should be dietary fats, okay? So that one is recommended, and the DASH diet actually is going to be best for those with hypertension, or if you have a family history of hypertension, this will decrease your risk of developing hypertension. So those are going to be your top 2 low-calorie diets that are recommended. The second type of diet that we're going to talk about is a low-fat diet. So an example of this is like Jenny Craig has a diet, and it focuses on eating smaller meals, roughly 6 meals a day, in which you're going to have meals that are really low fats, right? So low-fat pattern with healthy carbs. So your healthy carbs are going to be carbs in fruits, vegetables, and whole grains. Secondly, you're going to be instructed to start counting the grams of fat instead of counting the grams of calories, okay? So, for example, if you're looking at a nutrition label, it recommends that keeping calories from fat below 30% of the total calories. So, for example, 33 grams of fat are in each 1,000 grams of food that you take in. So if you're on a 1,500 calorie diet, then we don't want you to consume more than 45 grams of fat. This type of diet can be very costly, so that's one of the big drawbacks. And the third diet that we're going to discuss is the low carb diet. So we want you to make healthy choices, and you're going to consume foods that are low in carbohydrates, and the fat content should be mono or polyunsaturated fats. Okay, and foods that contain low amounts of fats are going to be proteins like fish, nuts, legumes, and chicken. Low carb diets, super low end would be 60 grams of carbs per day. And then on the higher end would be about like 180 to 160 grams. Of a super low carb diet would be maximum of 100 grams of carbs per day. Very low carb would be something less than 60 grams of carbs a day. I don't really recommend that, and always check with your physician. Carbs are like our source of fuel. Carbs are readily converted into sugar, or glucose as we call it in medicine. And glucose is what your cells uptake directly to use as fuel. So when it came to research studies, there were 5 trials that found a difference in weight loss at 6 months. And it favored being on a low carb diet, okay? But they did find that weight loss was not sustainable over a 12-month period. Tightly restricting carbs is going to be very, very hard. So most common example of carbs that are not necessarily nutritious are those from potatoes, pasta, and white rice. And if you're on a super low carb diet of 50 grams of carbs or less, you can develop ketosis. And that can lead to rapid weight loss, but it's primarily due to glycogen breakdown. Glycogen is your body's stored glucose in your liver. And that weight loss can also be attributed to fluid loss rather than fat loss. Very low carb, ketogenic diets are associated with a small increase in energy expenditure, and it decreases over time. A low carb diet with healthy choices for fat and protein have some beneficial effects with regard to risk of developing type 2 diabetes, hypertension, and cardiovascular disease. And it also may reduce your risk of developing cancer. We live in a society to where we want quick fixes and we want packaged things because it's easy to grab and go. I want to make one point very clear, is that anything that's in a package, okay, contains preservatives. Preservatives help it stay in that package so that it's not degraded by bacteria. And it's harder for your body to break down. It's always going to be better to consume your carbs from fruits, vegetables, or whole grains, or lean protein, because your body knows how to break that down more efficiently, and it's going to have your recommended nutrients, minerals, and vitamins already in there. And those nutrients that you get from consuming those fresh foods are going to be more easily absorbed by your GI system than if you had supplements or anything like that. Even though you have, say, a multivitamin, there's only a percentage of that vitamin that's going to be absorbed through your gut. My take-home message is, don't just look at the diet. You want this to be an overall healthy lifestyle. Now, if you need some form of surgery, like a knee replacement or something of that sort, and you're morbidly obese, your doctor may suggest a super low carb or super low calorie diet in order to get to that surgery because you need it. So that makes sense. But for those of you guys that are overweight or obese and want to lose weight, the best course of action is going to pick a diet plan that is going to give you the immediate and long-term results. Let's talk about a couple of the research study. So they had a 26-year follow-up of women in Nurses Health Study, and also 20-year follow-up of men in the Health Professionals Follow-Up Study. They were on a low-carb diet, some that were stratified into a group that had on the higher end of that low-carb diet and ones on the extremely low end of the low-carb diet. There was actually a relative risk reduction of cardiovascular disease, and especially associated with all-cause mortality in the low-carb diet group. The great thing about research studies is that you want to follow up, because 26 years to follow up is pretty impressive. So overall, compared to the control group that they didn't do any major modifications, they had a risk reduction. So their risk of developing heart disease and dying from heart disease was low, which is major. I always recommend to my patients, unless there's some nuance, a low carb diet. But going over what are healthy carbs and what are not healthy carbs is pretty essential. Education is going to be the biggest hurdle when it comes to choosing the foods and changing your lifestyle. Because if you're used to doing the grab and go thing, it is a big shift. I'm not even going front. It's a big shift to now start eating fresh and also allotting time to prepare these meals. The fourth diet that we're going to talk about is the high protein diet. Ladies, I want you to listen to me and really listen to this, okay? High protein diets, if you are not working out or lifting weights, there are carbs and protein. And if you are not exercising, you will gain weight. You will gain weight. Adding just pure protein to your diet, especially the protein shakes and the protein bars. If you are trying to lose weight, I do not recommend implementing a protein shake or a protein bar, because you're going to see that increase. Now, if you're lifting weights and you're trying to bulk up, yes, add on the protein. Let's talk about a couple of the studies, because I'm a researcher at heart and it's all about the numbers, baby. The long-term effects of low-fat diets with either high or low protein content. One study compared. There were significant differences in weight loss, waist circumference, lipids, and blood pressure. The second meta-analysis compared short-term effects of a high-protein diet. So what it showed was a modest reduction in weight, fat mass, and triglycerides with a high compared to standard protein diets. Overall, higher protein diets may improve weight maintenance. They don't necessarily lead to a dramatic reduction in fat loss. I use Ozempic, compounded Ozempic, or brand name Ozempic for my patients that are morbidly obese, or definitely if they have type 2 diabetes. A lot of the online reviews and complaints that some patients notice when they stop Ozempic is that they gain the weight back. The reason why patients gain the weight back is because if they're doing a super low carb diet, or if they're not eating at all and basically super deficient in calories and carbs, it's not sustainable for the long run. Your body is very smart. It will adapt and adjust to that, and you'll see the weight gain back. So a high protein diet, long term, that's going to be for your weight maintenance phase. The fifth diet that we're going to discuss is the very low calorie diet. So diets with a calorie restriction of 200 to 800 calorie a day are called very low calorie diets. Diets that have below 200 calories a day can be termed as starvation diets. I do not recommend a starvation diet. Again, even if you're on Ozempic or Mounjaro, we do not recommend a starvation diet. We don't want to go through extremes, okay? The extreme of either binge eating or eating high carb, high caloric foods is not a good thing. Neither is not eating at all. So I recently heard about the walnut moms. So they're on Ozempic, they want to lose weight, and when they feel hungry, they eat a walnut. That is definitely less than 200 calories a day, and that is a starvation diet. And it can lead to muscle mass breakdown, protein breakdown. Don't do that. Long-term weight loss maintenance between low-calorie and very low-calorie diets was not shown to have a difference when we followed up on the patients in this trial at 5 years. So you want long-term effects. So if you go on a super low-calorie diet versus a regular low-calorie diet, at 5-year mark, the weight loss, or the weight maintenance rather, was the same. So there's no reason, unless indicated by your doctor, for you to go on a super low calorie diet. The side effects of a super low calorie diet is hair loss, thinning of the skin, coldness. For the people in the back, Ozempic face. That term, I had to look it up when I had a new consult. I don't want to get Ozempic face. I'm like, Ozempic face? So that is because these patients that are on Ozempic, either for diabetes or they're getting it compounded by a reputable compounding pharmacy, they're using the medication because it suppresses your appetite in your brain and it does a whole bunch of other things on your body, but you're not hungry. So they're using that to essentially become anorexic. So if your skin thins,
it's gonna sag until you get Ozempic face.
we don't want Ozempic face, okay? And ladies, we love our edges. We don't want to lose those. So I know you guys want to get to your weight loss goals and have that hot girl summer, that body for the summer, but this is about long-term goals, okay? So don't starve yourself. Just eat the right healthy things and make sure that it has the nutrients in it that you need, okay? So also, another point of that is that diet, very low calorie diet, is contraindicated in individuals who are breastfeeding or who plan to become pregnant. And children, especially, very low calorie diets are not recommended because children need protein and they need their nutrients because it will cause a decrease in their ability to grow. And you don't want to do that. We want to implement healthy habits. And if there is a child suffering from obesity, it's always best to see a pediatrician and a pediatric nutritionist to help that child to lose the weight. But don't go online and then put everybody in the house on this restrictive diet because it can lead to some very serious complications as well. And then another important fact is that with all diets, whenever you're losing an excessive amount of fat, it breaks down into byproducts and it will cause a elevation in your cholesterol mobilization from the peripheral fat stores or the fat that you had stored in your abdomen. So if I pull your labs, your cholesterol panel is going to be high, and that can increase your risk for gallstones. So again, very low calorie diets are reserved for individuals who require specific weight loss for specific purposes like a surgery. If a patient has a blockage in their heart and they need to have a quadruple bypass or something of that sort, okay? The last diet, and I'm kind of biased, but we're going to go over all of the facts, it's intermittent fasting. Intermittent fasting involves either eating every other day or restricting eating to a certain time of the day. So this diet has been studied for a while in mouse studies and rat studies, also in humans. So we're going to talk about the two human trials. So there was a clinical trial of obese patients that compared intermittent fasting, eating every other day, versus a restricted time fasting. So stratified patients into those two categories, and it lasted 12 weeks long. They saw about an average weight loss of 11.4 pounds, okay? And the amount of weight loss compared to the two groups was not really different. They lost about the same amount of weight. The second trial was 1 year long and it included 100 people that were clinically obese, and they were assigned into either an every other day fasting with 25% of their calories consumed on the day of fasting, and then 125% of calories consumed on days that they would eat. Okay, and then they compared that group to a calorie restricted diet of 75% of the total calories that you could eat a day, which probably like 1,500 to 1,750. Okay, and then they didn't do any type of diet in the control group. They compared them 6 months and 12 months, and the average weight loss was about the same between the two groups. So not really a difference. So if you want to do the every other day fast, I don't recommend that. You will lose weight, but you can just do intermittent fasting where you pick an 8-hour window out of the day that you eat and the rest is for fasting. And then let's talk about time-restricted feeding, or the one that I just mentioned, which is picking a certain block of time throughout the day that you eat, and then the rest is fasting. The research showed really good positive benefits. You have improved insulin sensitivity and anti-inflammatory effects. So improved insulin sensitivity means that insulin is released by your pancreas. Insulin is needed and secreted so that your cells can uptake glucose. Without insulin, you can have all the glucose, which is the usable form of energy, float around your bloodstream all day, but your cells can't pick it up. It's like, where is all the glucose? Where is all my energy? I can't pick it up. It's akin to if your car is out of gas, you go and get a gas tank and you sit it 2 feet from the car. of course, the car can't start. So that's what insulin does. If your body is more sensitive to the insulin, it's able to better uptake the glucose from out of your bloodstream, because glucose can damage your vessels and leads to cardiovascular disease, kidney disease, all of these things, right? And it's able to use it more efficiently. Your cells are able to use it more efficiently. So that is a pretty good thing. The trial also showed that alignment of feedings with the circadian rhythm results in greater weight loss and improved metabolic parameters. A recent study also showed that people that work overnight have a higher risk of cardiovascular disease and cardiovascular deaths than those that work during the day. So it was also interesting in doing my research for this podcast that weight loss and obesity was also tied to people that work overnight. It further reaffirms, at least for me, our body's connection to the sun, the moon, the earth, and that we overall function better, and we're supposed to be asleep at night. And when we try to bend that, it increases our risk for death. Let's talk a little bit about how the brain works. When the sun is down, your brain naturally produces melatonin. Melatonin is produced by the pineal gland, which is located in the back of your brain. When you try to get sleep throughout the day, and trust me, I understand it, because during residency, we all have worked those night float shifts. It's not a recuperative sleep. I don't care
it showed
if you have the best blackout lines. For some reason, that sleep is just not
your circadian
rhythm, meaning that if you're eating throughout the day instead of throughout the night, it led to more weight loss, and that you're able to maintain your weight once you lost the weight better. And that study included 139 adults with obesity. At the 12-month mark, in both the groups, they lost weight. Loss was not significantly different in the two groups. In general, the consensus of most nutritional societies and medical societies conclude that overall, the two diets that are recommended are the DASH diet and the Mediterranean diet. Those two diets involve a mixture of fresh fruit, vegetables, and lean protein. I will also paste a link containing the specific instructions for a Mediterranean or a DASH diet below. So definitely check it out. The DASH diet actually stands for Dietary Approaches to Stop Hypertension. This is the only diet that is actually recommended for people with hypertension or that have a genetic predisposition to developing hypertension. Another important part that is going to be very, very crucial in not only achieving a healthy weight, but being healthy overall, is understanding how to read a nutrition label. I cannot stress that enough. That is going to tell you what is really in that food that you're eating. And do you know why fruits and vegetables don't have nutrition labels on it? Understanding how to read
it doesn't have
that
any
nutrition
additives.
label
It's
is
just
so
that.
key.
The banana
Because it can
is just the
help explain
banana.
if this food is healthy or not. Okay? If this food, like a bag of Funyuns, which used to be my favorite, it still is, but I gotta avoid it, right? It's high in carbs for a very small fun size bag. Okay, but if you look at the nutritional ingredients in there, all of those are additive and it's high in calorie, but it doesn't have many nutrients. So nutrient rich foods contain naturally, it doesn't say though I had to add this to it to have some nutrients to be termed a food. It already naturally has potassium, vitamin C, zinc, all calcium. It doesn't have to be added to it. So you want foods that are going to be low cal, high nutrient, instead of high cal, very low nutrients. And a lot of those nutrients that they add are not even absorbed because it's not in a usable form for your body to absorb it. So keep that in mind. So in general, you want to have a diet that consists in reductions in refined carbs, processed meats, and foods high in sodium and trans fats. What is the key component? Key component in processed meats. So processed meats are hot dogs, pickle meat. I know pickle meat. Us New Orleanians, pickle meat is essential for our red beans. So any meat that basically is in a package with some fluid around it, those are going to be your processed meats, and those are not good. You want to, I don't say don't consume it, but consume it in very low quantities. Your lean meats are going to be like your chicken that is fresh, never frozen. So those are going to be your go-to ones. And then moderation in intake, so very little intake of unprocessed red meats. So eating a steak every day would be terrible for your heart. Don't do that. So limiting it. I'm not saying you cannot have that filet mignon, that ribeye, just not every day. Okay, so limit intake, because restriction leads to rebellion, and we don't want rebellion. And also moderation in poultry, eggs, and milk. So the reason why we want children to have milk is because it contains calcium, vitamin D, and healthy fats. Those healthy fats are needed for brain development, bone growth, all of those different things. So that's why kids, we recommend them to have milk. Not fruits, vegetables. So let's talk about foods that you can have a high intake of. Now, I will say a caveat with nuts. Look at that serving size, okay? So for my ladies, nuts, if you look at the amount of carbs and if you're trying to eat it, especially those trail mixes, it does not say to eat the whole big bag of trail mix. That is equivalent to having a high protein, high calorie diet, and you will gain weight. So for me, because nuts are delicious, especially trail mix, and I'm going to eat the whole bag. So personally, I just eliminate that or have it in very, very small moderation, meaning you buy a little bitty bag. Don't go to Costco and get the whole box, because guess who's going to eat it? Me. If it's not in my house, I ain't going to eat it, type of thing, and I recommend that. Also, oil, so your healthy oils. So extra virgin olive oil is a really good one if you're going to pan sear things or pan fry things. Grapeseed oil, those are going to be lower in saturated fats, and it's going to be a lot more healthier for you. Minimally processed grains, legumes, and yogurt are preferred over ice cream. Definitely preferred over ice cream. And this approach allows greater flexibility with personal preference and may lead to improved long-term adherence to the diet. So that's why I don't use that dirty word diet, that dirty diet word. That is, I don't like using that. I call it a lifestyle. And if you implement the lifestyle, your brain gets used to it and you're going to feel a whole lot better. If you try to go back to eating the way you used to eat, yes, you're going to feel tired. You're going to feel fatigued, and your taste buds change as well. I used to be crazy about Coca-Cola in undergrad, had migraines, and guess what? When I saw the neurologist, he recommended eliminating chocolate and eliminating Coke or decreasing it. When stopping drinking Coca-Cola, I had the worst migraine. It's high in sugar and caffeine, but I felt a lot better. I tried to taste Coca-Cola a couple of years ago, and it was so sweet. Your palate changes, your brain changes. And if you really, 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 really want to know how your brain works and how those pleasure centers light up, try going without some of the unhealthy foods or processed food for a month, and then try to eat it or drink it again. And it's going to taste really unappealing. Drink your water and eliminate the calories in the drinks that you don't need. Okay? Portion control is another big issue. Try, when you're starting a new lifestyle change, try making your plate on a saucer. Okay? You can always go back for more, but put a right amount of size of things on your plate. The most of your meal should be a vegetable. Okay, it shouldn't be the whole rice. It shouldn't be a whole bunch of rice and a dollop of beans. It should be more beans than the rice. When you make collard greens and rice, it should be a half a cup of rice and a whole bunch of collard greens. So flip that ratio, and if you're trying to lose weight, the number will go down. Trust me. And that's without doing any super calorie restricted or carb restricted diets. Okay. And then self-monitoring if you're just getting started. So depending on an app, if that's your thing and you're regimented, do your thing. But for the majority of people, anytime there's a restriction or I'm telling you something that you have to do, it may get you to your weight loss goals initially, but it's not sustainable. So My exercise for everyone that has 20 pounds to lose or 120 pounds to lose, I want you to start looking at your nutrition labels. Okay. Look at your nutrition labels, pick a diet that works for you. And I want you to start to get an idea of what you're eating and what's the serving size, because those calories and those carbs in that food is going to be according to that serving size. Okay. So if it says a bag of chips and it says the serving size is 1/8 of the bag, 1/8 of the bag, I'm going to help you out, sis, or I'm going to help you out, cuz. Put it back. Put it back. Okay. Just put it down. Don't even touch it. Okay. And also, pick an amount of carbs that you want to eat in a day. I find it easier for myself to count the carbs instead of the calories. And the reason I do that is because I have a chemistry background. Carbs are your body's usable, it converts easily into glucose, one step. Right? So the more complex carbs that you eat, which are going to be in your whole grains and in your vegetables that are not cooked to mush, okay? Your body has to break that down. It takes more energy. So you're burning energy just to break that food down, right? You're going to feel fuller longer. And it has lots of vitamins and minerals in there. And why it's breaking it down, because it's more complex. Guess what? That vitamin A, that zinc, that magnesium, the calcium, the D, A, B, C, D vitamins, all that is going to be absorbed way more efficiently. So your skin is going to glow and pop, okay? That hair is going to be long, them edges full, okay? So you want to ingest those foods. Another tip. Do you notice that most grocery stores, there's a section right in the front? No, not the chip section. I'm talking about the fresh produce section. It's always at the front. That's where the majority of the calories that you eat should be obtained from, okay? Those are going to be the best for you. Let's skip over the frozen aisle. Frozen vegetables, okay. Because I understand fresh fruits and veggies are expensive, and also they don't have a super long shelf life. I get it. Frozen vegetables are going to be the next best thing. Also, when it comes to rice, that's going to be my guilty pleasure. I like white rice, but brown rice, it has more complex carbs, so your body takes, that extra energy to break it down. So it's going to be recommended for greater weight loss over the long haul. But for me personally, because I'm not going to act holier than thou, that's my guilty pleasure. But I don't consume it in large quantities. And for my meals later on the day, I prefer to just have a pan-seared fillet of trout with the skin on and just some broccoli. It tastes good to me, and I am full. Have you ever tried to eat a whole bag of broccoli? You would be so stuffed. So start incorporating those healthy things. I don't want to make this podcast too long, but this is how to get started. I'll be talking about this more in my next podcast. I'll be bringing on a special guest who is a master trainer, and he's going to touch upon the exercise component. Remember, we only have one body. We only have one life. So don't budget shop on your body and invest time in taking care of this. You want your body to last a lifetime. What's the point of working for 30 years or your whole life, and then when you get to retirement, you can't enjoy it because your leg has to be amputated from complications with diabetes, or you have hypertension and you had a stroke and now you're disabled or you're paralyzed on one side of your body. All of these conditions, majority, and now there are some exceptions with autoimmune diseases and things like that, but for the majority of the time, it's preventable. It is preventable. Talk to your family about their medical conditions, because sometimes it's genetic. And if you know you have a genetic predisposition, meaning that if you know that your mama has hypertension and daddy has hypertension and diabetes, your chances of developing hypertension is more likely than someone whose parents don't have that genetic risk factors. So you can do things in your teenage years, in your 20s, definitely in your 30s, to where you're eating healthier and you're working out, and you may never develop those conditions. Thank you guys for tuning in to another episode of All About the Medicine with Dr. Nola Knows.